I had the citronella candles, but that wasn't enough.
Victoria Martinez's husband, James, hospitalized with a severe form of the mosquito-borne illness, West Nile virus, after the couple hosted an anniversary barbecue in their backyard.
And I thought, that's weird. He had a bunch of little bites.
His family saying he started feeling sick almost immediately and was rushed to the hospital, eventually hitting a fever of 108 degrees and requiring a breathing tube to survive. His brother not even recognizing him.
When I first came to the hospital to see him, I was like, I can't believe this is my brother.
As the summer heats up, doctors and public health officials warning conditions are ripe for mosquitoes.
We're seeing an uptick in cases in West Nile virus, including, unfortunately, related illnesses, hospitalizations, and the recent death. We've had rains that are unprecedented and a lot higher temperatures. That's like a perfect melting pot for these viruses to thrive.
There have been more than 50 reported cases of the virus this year in states across the country, according to the Centers for Disease Control and local health departments. Philadelphia announcing today it had detected mosquitoes carrying West Nile in a city park, immediately jumping into action and doubling down on mosquito spraying.
Activity will get ramped up in general. This has been the same for the past several years, because once we find that first positive case of mosquito that has West Nile virus, we know there's going to be more.
Only about 20% of people infected will experience symptoms, according to the CDC. So if you think you've been bitten by an infected mosquito, doctors say keep an eye out for these symptoms.
If you have a sudden onset of the worst headache of your life, if you have a stiff neck that is completely out of proportion to the activity you've been doing, and if you're experiencing fevers that you can't reduce with fever-reducing medication, get to a doctor as quickly as possible.
All right, scary stuff there. Priya Sridhar joins Top Story Live tonight. Is there any treatment if you or someone you love is getting bitten or gets bitten by an infected mosquito?
Yeah, Tom, that's a great question. And the answer is, unfortunately, no, there is not. But what doctors really want to emphasize, as we mentioned in the piece, is that the overwhelming majority of people who actually get West Nile virus don't even know they have it because they're asymptomatic. Only a tiny fraction, about 1%, get symptoms that are so severe, like what you saw in the piece right there. And that's because the virus actually develops into a neuroinvasive disease that can impact your brain and spinal cord and can potentially be fatal. And in those circumstances, if you do get it, doctors say you just have to let it run its course. But there are things you can do to prevent yourself from getting it in the first place. And the number one most important thing is to wear EPA-approved insect repellent, preferably ones that have the chemical DEET on the back. Doctors also say to try to avoid walking outside, walking your pets, or going on hikes at dawn or dusk. That's when mosquito activity is at its peak. They also say, and this is going to be a little bit counterintuitive, Tom, because the height of mosquito season also coincides with the hot summers, but they say if you live somewhere where you see a lot of mosquitoes, maybe wear long sleeves and long pants to try to prevent yourself from getting bitten. Stay away from standing pools of water. If you see any of those around your house, try to drain them, and also look at the screens in your windows for any holes and try to patch those up, Tom.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.